Hello again, Jennifer here, your favorite speech therapist that is helping you become an amazing caregiver. Today we are cracking the code on how to swallow pills. So I want to start this video by saying that swallowing pills is a pretty cool move. There is really nothing else you put in your mouth, except liquids of course, where there is no expectation to manipulate the food or to chew it. And because of that, each and every person seems to have their own unique way of getting pills down the hatch. So this video is not intended to change the way you or your loved ones swallow pills. Like the saying goes, if it ain't broke, don't fix it. But if your loved one begins to develop problems when swallowing their medications, then this video can help. I will start by going over some techniques that can help pills go down easier. And then I will talk about some ways to modify the pills if swallowing them whole is no longer an option. A quick note before I begin though. For each of these techniques, only try to swallow 1 to 2 pills at a time, depending on the size and the type, like if they are tablets or capsules. Capsules typically go down a little easier. Oh, and the title to these techniques were made up by me, so I hope you can remember them a little easier and enjoy them also. Technique number 1, the water slide. For this technique, you will start by swallowing a small sip of water. Next, place the pill on the middle part of your tongue and take another sip of water, this time swallowing the water and the pill together. Then take another sip of water to keep the pill moving down the throat, and repeat for each pill. Technique number 2, I'll drink to that. This method has your loved one using something a little thicker than water, like tomato juice or drinkable yogurt, or something with carbonation, like club soda or Sprite. The thicker liquid will give the pill something to bind to, and the carbonated drinks can help transport the pill quickly. Both will help keep the pill from rolling around inside of the mouth. Technique number 3, tucked away. After placing the pill on the middle of your tongue for this move, you're going to take a small sip of water, and then you're going to slightly tuck your chin towards your chest. We call it a chin tuck, and then swallow. A common misconception about pill swallowing is that it's easier to tilt your head back, like this. But that actually helps to open up the airway and can cause the pill to go down the wrong pipe. So, keeping your head neutral or tucked forward is the better method. Technique number 4, Puree the Way. For this technique, put the pill in the center of a teaspoonful of applesauce, yogurt, or pudding. After taking the bite of the food, the pill will slide right down with it. And technique number 5, the cha-cha slide. For around $7, you can buy a pill glide spray that helps prevent the pill from sticking to your tongue and allows it to easily slide down your throat. To use, you're going to simply coat the tongue with the spray, place the pill on the tongue, and then swallow with a sip of water. Now, caregivers, you may be asking, which technique do I use for my loved one? And all I can tell you is it's all about trial and error. But hopefully you'll find one that works. But if you don't, never fear. There are some other things that you can try. First, try getting as many of the medications in liquid form from your doctor. Then, consider splitting bigger pills or vitamins in half using a pill splitter. I'll attach a link. And if all else fails, then it may be time to crush the medications and put them in applesauce, yogurt, pudding, or any other pureed food. Now, it is very important to know that not all medications can be split or crushed because they may be time-released, meaning they release the drug over a long period of time. So always talk to your doctor or pharmacist before altering any medications. There are also 2 more things that I want to mention. First, there are hundreds, if not thousands, of different medications out there. A discussion with a trusted doctor on prescribing only the most important life-saving medications may be needed if your loved one is really struggling with taking their medication. Vitamins and supplements are good, but sometimes you might have to weigh the benefit of the pill versus the risk of your loved one choking on it. Also, if possible, divide your loved one's pills throughout different times of the day, like morning, noon, and evening, so that they aren't having to take so many at one time. Caregivers, y'all are the best. Thanks for watching, and until next time, good luck cracking the code.